Hello, everyone. Welcome to the Mental Health Podcast. I'm Jack, and I'm with Ricky and Luca. Today, we are going to be discussing schizophrenia. So basically, schizophrenia is a chronic brain disorder that affects less than 1% of the U.S. population. When schizophrenia is active, symptoms can include delusions, hallucinations, disorganized speech, and some other things. Uh, most common, however, with treatment, most symptoms of schizophrenia will greatly improve, and the likelihood of reoccurrence can be diminished.
I think it's important to note before we go further into the schizophrenia thing that schizophrenia does not mean split personality or multiple personality disorder. Most people with schizophrenia are not any more dangerous or violent than most people in the population. And limited mental health resources and community is generally what leads to the stigma of most schizophrenics being homeless and hospitalized very often. And it's a huge misconception that all these people are just crazy.
Yeah, it also contributes to the stigma, which doesn't help really any part of mental health
Yeah,
in the
exactly.
development of making our mental health system better in Canada and well anywhere in the world. Just like making it more, I guess, acceptable.
Yeah.
I think it's really important to raise awareness for issues like this, where we're stigmatizing these mental health disorders, to make it more accessible, and not only that, to make people feel more comfortable with going to their doctors, their family doctors, and or the psychologists, and admitting to them that they think they have this, so they can get an evaluation. Sometimes I think it can be hard to admit or even want to like discuss mental health because of the stigmatization and how you think other people will perceive you after they find out what you have, and that is part of the trouble of stigmatizing mental health disorders. What do you
Yeah,
guys think?
for sure. I have to 100% agree with that. I think a large issue too is like the whole, at least I know in my family, there's this whole mentality that, oh, you're depressed, just stop being sad. Or, oh, you've fallen down, just get back up. This idea that
Yeah.
it's nothing and just sort of shoving it to the side like it is nothing. And then it could be, there are many disorders and everything. Like I think taking pills or just trying to better yourself overall and like trying to figure out what these are, and that idea of always trying to find yourself is always just a very good thing to do. You know?
Yeah, it's important to recognize that mental health disorders are just as important as your physical health. Like, taking care of your mental health should be like, it should be the same as taking care of your physical health. You should be constantly checking up on yourself, even having a doctor just for your mental health. Because when you go to your family doctor, it's mostly your physical checkups and stuff, your blood work. You know what I mean? All
Yeah.
that. But it kind of gets neglected, the mental health side of it, and that I think is really unfortunate.
Mhm.
What do
And
you
a good
think,
mental
Ricky?
health also provides a good well-being physically as well. As you are, the better your mental health state, the more I feel more active you are in your life, and the more enjoying it you are, and the more you enjoy life, the healthier you are.
Mhm. Yeah. So, leading this back more to schizophrenia, Ricky, would you like to say a little bit more about the various symptoms and their categorization?
Sure. So when the disease is active, it can be characterized by episodes is unable to distinguish between real and unreal experiences. As with any illness, the severity, duration, and frequency of symptoms can vary. However, in persons with schizophrenia, the incidence of severe psychotic symptoms often decreases as the person becomes older. Not taking medications as prescribed, the use of alcohol or illicit drugs, and stressful situations tend to increase these symptoms. And symptoms fall into about three categories: positive symptoms, those abnormally present, such as hallucinations and delusions; negative symptoms, those abnormally absent, like a loss or a decrease in the ability to initiate plans, speak, express emotion, or find pleasure. And then finally we have the disorganized symptoms: confused and disordered thinking and speech, trouble with logical thinking, and sometimes bizarre behavior or abnormal motor behavior. Researchers believe that a number of genetic and environmental factors contribute to causation, and life stressors may play a role in the start of symptoms and their course. Since multiple factors may contribute, scientists cannot yet be specific as the exact cause of in each individual case.
Yeah.
So yeah, those are like, I guess, just to get a quick gist about symptoms and
Yeah.
their causes and origin.
I think it's also important to discuss how the disease is portrayed, or it's not a disease; it's a disorder. I shouldn't say that.
Yeah.
How it's portrayed in media and in movies and stuff, and how the symptoms are shown to be. Like when you think of someone with schizophrenia, you think of a crazy person. Like as bad as that is, that's just how it's been portrayed in movies for the
A lot of
longest time
Hollywood. A
now.
lot of Hollywood is
Hollywood, yeah,
Mhm.
how they're always constantly portraying as the crazy killer or whatever, if you know what I mean.
Yeah, exactly. And it's one of those mental illnesses that you just sort of like slap on a person to make them seem more crazy or more or like more distant, you know? Like as you were saying with the whole killer thing, it's like, oh, he's a schizophrenic psycho killer or whatever, right? Putting schizophrenic in front of it really drives that disconnect.
Yeah.
And
Oh,
giving it that sort of power, doesn't help with the stigma for people who actually have schizophrenia in the real like in the real world.
exactly. When in reality, these people are functioning members of our society. Like they're capable of so much, and because of the stigmatization, we just shove them all in this box and say, "Oh, they're all crazy, and they need to go to like a mental health ward," which is just insane. Which is why breaking the stigma and raising awareness for issues such as this is so important. So these people can feel comfortable coming out to people in their lives saying that they have schizophrenia, or be comfortable with going to get help from medical professionals.
Yeah. Uh, I know that for my family, it was pretty hard when we found out that my brother had schizophrenia. Um, and especially because of all of these like stigmas and everything. And we thought he was like, I was younger at the time. And so we thought that he was like going to go fully crazy. And my dad and my mom did a very good job of being there to support him. And I think that the ability of being there to support him through all of that and helping him through his various symptoms and everything was also very important in breaking my personal stigma against schizophrenia. And I think knowing people who have schizophrenia really helps, um, I guess, almost dilute the idea. Because I don't know. Even the word schizophrenia is a very like angry sounding. Like it doesn't sound nice. You know what I mean? Like that's like it's
Yeah.
very weird, but it makes it sound crazy in a weird way. And I think it's very important to sort of dissociate those two things.
So as you said, once you meet someone with it, then you can really understand what they're like, and it's not so different from you and I, right?
Yeah, exactly.
Yeah. Um. What was I gonna say? Should we move on to our next point?
Sure. So next we're talking about treatment of schizophrenia. So a variety of antipsychotic medications are effective in reducing the psychotic symptoms present in the acute phase of the illness, and they also help to reduce the potential for future acute episodes and their severity. Psychological treatments such as cognitive behavioral therapy or supportive psychotherapy may reduce symptoms and enhance function, and other treatments are aimed at reducing stress, supporting employment, or improving social skills. After the symptoms of schizophrenia are controlled, various types of therapy can continue to help people manage the illness and improve their lives. Therapy and psychosocial supports can help people learn social skills, cope with stress, identify early warning signs of relapse, and prolonged periods of remission. Uh, yeah, so like as we can see here, it's like these people, once they're treated and once they are helped, like they're normal, like they're just like the rest of us. They can have jobs, they can have friendships and social lives. It's like you won't be able to tell the difference unless they probably tell you.
Yeah.
Was it like that with your brother?
Yeah, it was a lot like that with my brother. I mean, like again, I didn't even know that he had schizophrenia when for like years after. He was diagnosed with it pretty young, and I didn't know until he's like what 17. He got it when he was diagnosed around like 13, 14. And I had no clue. I just sort of thought of him as my brother. And I think again, knowing someone with schizophrenia and not getting told that immediately, really, you don't change your mind about the person because you have no idea nothing's wrong. And I think that's something with mental illness as a whole. It's sort of, once you hear someone has a mental illness, you almost think different of them, which you really shouldn't. And I think that's a huge issue when it comes to schizophrenia and all of these sorts of um, diagnoses,
Yeah.
all sorts of things, right? And so I think it's very important that we're able to talk to these people without looking past their disease, whether it's schizophrenia or bipolar or general anxiety disorder, PTSD, CPTSD, whatever it may be. It's very important to just sort of look past that and just sort of understand the person that they are. And I think if we are able to do that with more people, we might be able to sort of curb the stigma for a lot of these mental illnesses.
Yeah. What do you think, Ricky?
No, I agree. I think the idea for most people is Hollywood feeds a lot of our interpretation of a lot of ideas and these disorders as well, because we don't really get that firsthand experience, and whether that's our fault as people or as a society, that's another conversation. But I think once you actually get to know someone, that's the easiest way to break the stigma. But I think the first area we always got to conquer is the mass media of the misportrayal of people with schizophrenia and other mental disorders. But we should probably be wrapping up about now. So I guess I can touch on. You can touch on the last point.
Do you want to close it up for us then, Ricky?
All right. So overall, it's important to separate the stigma that those with schizophrenia are not crazy and hear voices in their head 24/7. Rather, they are also just functioning human beings that live in our society who may face challenges not like us, but that doesn't make them any different from any of us. We're all human beings at the end of the day, and we need to destroy these stigmas that convince us that they are just different from us and evil in a way.
Yeah. I think it's important to, the next time you meet someone who you know has a mental disorder, try and get to know them before judging them based on what they tell you they have, right? And then you'll realize that they're more like you than you think.
Yeah, 100%.
Good way to put it.
Yeah.
Well, yeah, that's a good time to end our first episode of the podcast.
Thank you for listening to the first episode. Our next episode will be on GAD, general anxiety disorder. Thank you for listening.